Good afternoon. My name is Diane Varga. I'm with Family Partners of Morris and Sussex, and we welcome you to this week's Lunch and Learn. Today is September 5th, 2024. Our speaker today is Jasmine Anderson. Jasmine is with the Partnership for Maternal and Child Health of Northern New Jersey. That is definitely a mouthful there, Jasmine.
Yes.
And she is the Immunization Education Specialist, and she will be speaking today on adolescent immunizations. Welcome, Jasmine.
Yes, thank you, Diane. Yes, we are the Partnership for Maternal and Child Health of Northern New Jersey. It can be a mouthful, so we often go by the partnership or PMCH. And so I am going to, let me start this up, and then I'll get into my spiel. Okay. So, good afternoon, everyone. As Diane said, my name is Jasmine Anderson. Sorry, I had subtitles going. My name is Jasmine Anderson. I am the Immunization Education Specialist for the Partnership for Maternal and Child Health of Northern New Jersey. And thank you all for joining today's webinar on adolescent immunizations for children ages 10 to 18. So this activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. At the conclusion of this webinar, you will be able to explain what vaccines are and how vaccines work, discuss why adolescent immunizations are important, name which vaccines are recommended for adolescents, and identify which vaccines are required for New Jersey schools. These are all of the diseases adolescents can be protected from: COVID, HPV, whooping cough, meningococcal disease, and influenza all have vaccines that are recommended for adolescents. And those are the diseases I'm going to discuss more about, as well as the vaccine recommendations. Adolescents should have received vaccines for the other diseases listed here, like diphtheria and polio. But if adolescents missed any vaccinations as young children and babies, they are able to catch up. And I'll talk a little bit more about that later in the presentation. So we are currently seeing a resurgence of vaccine preventable diseases in the United States, measles being one of them. In the year 2000, measles was declared eliminated in the United States, meaning that it was no longer naturally occurring or prevalent in the United States. However, measles was and still is prevalent in other parts of the world. That means that anyone who is not vaccinated against measles can catch and spread measles to other unvaccinated people. There have been 236 cases of measles to date in the United States in 2024. That number actually increased in just a month. At the beginning of August, the total number of cases was 167. 40% of cases were in children under the age of 5. 30% were in those ages 5 and older. 87% of the cases were in people who were unvaccinated or whose vaccination status was unknown. According to the CDC, there have been 13 outbreaks this year in the United States, and 69% of the 2024 cases are associated with an outbreak. 44% of the U.S. cases led to hospitalizations. 57% of the cases in children under 5 led to hospitalization. 30% of cases in those ages 5 to 19 were hospitalized, and 39% of cases in those 20 and older were also hospitalized. This data tells us that measles infection can be serious in most cases, and it just highlights the importance of routine vaccination. Now I'll take you through an overview of vaccines. I'll discuss what vaccines are and how they work, why adolescents should get vaccinated, the recommended immunization schedule for adolescents, and New Jersey's immunization requirements for attending New Jersey schools. So vaccines are safe, simple, and effective tools that protect us from harmful diseases or pathogens before we encounter them. Pathogens are viruses or bacteria that can cause disease. Viruses can include the flu or COVID-19, and bacteria can include tetanus and meningitis. So the following video explains exactly how vaccines work. And then if you can't hear it, please let me know, and I have to reshare my screen.
When your child gets a vaccine, an amazing thing happens. Just like a teacher, the vaccine gives your child a lesson. The immune system gets to work right away, learning what to do if your child is exposed to harmful germs. All of us are exposed to germs every day. Some might cause a cold or a minor illness, but then there are more dangerous viruses and bacteria that can make children very sick. Diseases like measles, diphtheria, and polio used to sicken and kill thousands of children. That's why it's important to get vaccinated, so your immune system will know what to do. Here's how that works. Vaccines contain either an antigen, a piece of the germ, or some instructions that tell us how to make the antigen. They teach your immune system to produce antibodies to get rid of the virus or bacteria. Then, those antibodies remember what to do if your child is exposed in the future. Vaccines can work in a few different ways. In some vaccines, the antigen is a virus that has been weakened. This means it will not be able to reproduce in your body to make you sick. But it does a great job of teaching your immune system to be ready for the real thing in the future. Other vaccines use a virus that has been killed, a tiny piece of a virus or bacteria, or a weakened form of a toxin, like the kind produced by the bacteria that cause diphtheria and tetanus. Same thing, it can't make you sick, but it teaches your immune system to recognize the germ. Getting one or more doses of a vaccine later on gives the immune system a memory boost, so it remembers what to do. The recipe for most vaccines is pretty simple. Besides the antigen, some vaccines contain aluminum salts, which help make the antigen work better, so children can get a lower dose. The amount of aluminum in vaccines is small, much less than your child gets from everyday food and water. Some vaccines also include a preservative to keep germs out, and tiny amounts of other ingredients, all very safe. After your child gets a vaccine, their arm may feel sore, or they may get a fever. That's a sign your child's immune system is getting stronger. After the vaccine does its job, it leaves the body and is gone. A week or two later, your child's immune system is better able to protect your child. Remember, vaccines have been given to millions of children and teens. They are closely studied, and we know they are safe and effective. In fact, vaccines work so well, most reduce your child's risk of getting these diseases by 90% or more. It's an amazing way to protect your child so they can stay healthy and safe.
So there are three reasons why adolescents should get vaccinated. Number one, to protect against diseases and infections where the risk of exposure increases as adolescents get older. One of those diseases where the risk of exposure increases as adolescents gets older is HPV. And I'll speak a little bit more about that later. But that's one of the reasons why you'll see a lot of vaccination series beginning at around the adolescent age. Number two, to boost protection. Because protection from vaccines can wane, additional doses of some vaccines are recommended. And then number three, to protect those around you who are not able to get vaccinated, like young babies and those who are immunocompromised. So those who can get vaccinated help prevent the spread of pathogens to those who can't get vaccinated. This is the 2024 immunization schedule for children and adolescents ages 7 to 18. It was developed by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians. It is important to follow the recommended immunization schedule for several reasons, but the most important reasons are that this schedule takes into consideration the most ideal timing for when children and adolescents should be protected, and the schedule ensures that children and adolescents receive early and long-term protection. Later in this presentation, I'm going to dive deeper into HPV, Tdap, meningococcal disease, flu, and COVID-19. And this is the recommended immunization schedule for children ages birth to 6. As I mentioned at the top of the presentation, for adolescents who may not have received any of these vaccines as children, they are able to catch up. Parents will need to speak with their child's doctor or healthcare provider to determine the best catch-up schedule. So there are 6 reasons why you should follow the recommended immunization schedule. As I mentioned, number 1, ideal timing is based on how adolescents' immune systems respond to vaccines and how likely adolescents are to be exposed to a particular disease. Number 2, it prevents complications. Delaying vaccines could leave adolescents vulnerable to diseases that can cause complications like meningococcal disease. Number 3, early protection. It's best to vaccinate before adolescents are exposed to dangerous diseases. If you wait until you think adolescents could be exposed to a serious illness, there may not be enough time for the vaccine can work. And that's definitely the case for the HPV vaccine. And when I talk about HPV, I'll reiterate that. Number 4, best protection. Adolescents won't receive the best protection from these serious vaccine preventable diseases until they get all of the recommended vaccine doses. Number 5, long-term protection. Many vaccines offer lifelong immunity against diseases. And 6, spreading illness. Adolescents who are not vaccinated on schedule are not only at risk of getting sick themselves, but they can spread illness to other people like newborns who are too young to get vaccines or those with weakened immune systems. There are immunization requirements in New Jersey for childcare, preschool, K-12 schools, and higher education. The vaccines that are required for schools do not include all of the recommended vaccines for children and adolescents. However, even if a vaccine is not required for school, it is still recommended that your child receives that vaccine to protect them. So for adolescents in grades 5 through 12, these are here that you see on your screen are the required vaccines to attend schools in New Jersey. The charts show the minimum number of doses required for each vaccine, depending on the grade that the adolescent is entering. So for adolescents in 5th grade, they are required to have the following vaccines: polio, MMR, which protects against measles, mumps, rubella, varicella, which protects against chickenpox, and hepatitis B. For adolescents in grades 6 and higher, they are required to have those the vaccines that I just listed, in addition to Tdap or meningococcal Tdap. And meningococcal Tdap just combines the Tdap and meningococcal vaccines. And I'll talk more about combination vaccines later in the presentation. So these charts are also available on nj.gov for your reference. So now we'll dive deeper into the vaccines that are recommended for adolescents and the diseases that they protect against. So HPV stands for human papillomavirus. HPV is the most common sexually transmitted infection. 9 out of 10 people will be exposed to HPV, and 8 out of 10 people will actually become infected with HPV. Most new cases of HPV are made up of adolescents and young adults. It can cause cancer and genital and oral warts. There are over 200 types of HPV that are either classified as high risk or low risk. High-risk types are associated with cancer, and low-risk types are associated with genital and oral warts. There are no symptoms of HPV infection, which means that it can be transmitted unknowingly. There is also no test to find out a person's HPV status. People may find out that they have HPV from an abnormal pap smear, when they get genital or oral warts, or after cancer develops. HPV is transmitted through any kind of intimate contact, which includes vaginal sex, anal sex, oral sex, genital to genital contact, and even just touching. The risks of HPV infection include the following cancers: cervical cancer, which is the most common cancer in people who have a cervix; penile cancer, which is the most common cancer in people who have a penis; anal cancer, vaginal cancer, oropharyngeal cancer, which is cancer of the mouth and throat; and vulvar cancer. There's also the risk of having genital or oral warts from an HPV infection. It is recommended that everyone between the ages of 9 and 45 receive the HPV vaccine. For adolescents, it is strongly recommended that the HPV vaccine series starts at age 9 because there is a greater immune response at age 9. The HPV vaccine is a cancer prevention tool. It protects against 9 HPV types that cause cancer and genital/oral warts. It is over 90% effective in preventing HPV-related cancers and warts. So as I mentioned, HPV is one of the diseases where the risk for adolescents increases as they get older. And that's because as they get older, they will engage in sexual activity. I know that's something that parents do not want to hear. However, as I mentioned, there is a greater immune response at age 9. And so you want to start the vaccine series at age 9 so that your child does develop that does have that strong immune response, and that will really protect them from all of these cancers that can develop from HPV. Again, it's over 200 types. There have been types that have been identified as being associated with certain cancers. But again, it's so many, we don't know which type of HPV we may become infected with. And so this is the best way to protect your child from HPV-related cancers and warts. Next, meningococcal disease. Meningococcal disease is caused by the meningococcus bacteria. Two types of infections that develop as a result of meningococcal disease are meningitis, which is an infection of the brain and spinal cord, and sepsis, which is an infection of the bloodstream. Symptoms of meningococcal disease include sudden onset of fever, headache, stiff neck, dark purple rash, drowsiness, shock, and coma. It spreads through direct contact in the air. Risks can include loss of limb, deafness, nervous system disorders, developmental disabilities, seizure disorders, stroke, and death. There are two meningococcal vaccines that adolescents can get. The first is the MenACWY vaccine, which protects against 4 different types of the meningococcus bacteria. And the second is the MenB vaccine, which protects against a different type of the meningococcus bacteria. It is recommended that adolescents receive 2 doses of MenACWY, 1 dose between the ages of 11 and 12, and another dose at age 16. For those at increased risk for meningococcal disease, the MenB vaccine is recommended at age 16 to between the ages of 16 and 18, in addition to the MenACWY vaccine. You can choose to have your adolescent vaccinated with both MenACWY and MenB. Those vaccines can actually be administered together in a combination vaccine that's called MenABCWY. But it is strongly recommended that you speak with your child's doctor to determine which course of action would be best for your adolescent. Diphtheria is a bacterial infection that makes it difficult to breathe and swallow. It attacks the heart, kidneys, and nerves. Symptoms include sore throat, mild fever, weakness, and swollen neck glands. Diphtheria spreads through the air in direct contact, and risks include swelling of the heart muscle, heart failure, coma, paralysis, and death. Tetanus is a bacterial infection. The bacteria that causes tetanus lives in the soil and causes lockjaw. Tetanus is the only naturally occurring vaccine-preventable disease, and it does not spread person to person. It spreads through breaks in the skin, which include wounds, puncture wounds, and burns. Symptoms include stiffness in neck and abdominal muscles, difficulty swallowing, muscle spasms, and fever. Risks include broken bones, difficulty breathing, and death. And then pertussis, also known as whooping cough, is also a bacterial infection that causes violent coughing fits. Symptoms include severe cough, runny nose, and apnea. It spreads through the air in direct contact as well, and risks include pneumonia and death. As mentioned, so pertussis can be extremely dangerous, especially for newborns, and it can also be dangerous for adolescents. And so it is recommended that adolescents receive 1 dose of Tdap at ages 11 or 12, and this would be in addition to the 5 DTaP doses that children get when they are babies. And so the only reason why that the names are kind of different for the vaccines to protect against these 3 diseases is because for adolescents, for the Tdap vaccine, the composition of the vaccines differ a little bit, like the amount. And so that's the only reason why there's a different name, but both vaccines protect against these 3 diseases, DTaP and Tdap. Seasonal influenza is an upper respiratory virus that infects the nose, throat, and lungs. Symptoms include fever, muscle pain, sore throat, cough, and extreme fatigue. The flu spreads through the air in direct contact. Risks include pneumonia, bronchitis, sinus infections, ear infections, and death. A common misconception about the flu is that it is not a serious illness, especially for children and babies. However, that is not true. Children and teens or adolescents can develop serious complications from the flu and be hospitalized, and the flu can be fatal. According to the CDC, 195 children died from the flu this past 2023-2024 flu season, ranging from ages younger than 6 months to age 18. And most of those children were not vaccinated against the flu. It is recommended that everyone, including adolescents, receive one flu shot annually by the end of October. Flu viruses are constantly changing, and the flu vaccines are reviewed and updated each year based on the most frequently circulating flu strains from the previous flu season. And you want to get vaccinated against the flu by the end of October so that you are protected for the full duration of flu season, which typically runs from about October to March. And lastly, COVID-19. COVID-19 is a disease caused by the SARS-CoV-2 virus, which causes mild to severe respiratory illnesses. Symptoms can include fever, muscle aches, sore throat, dry cough, headache, nasal congestion, fatigue, runny nose, diarrhea, vomiting, new loss of taste or smell, loss of appetite, or there may be no symptoms at all. It also spreads through the air in direct contact, and risks can include pneumonia, respiratory failure, blood clots, bleeding disorder, injury to liver, heart, or kidney, multi-system inflammatory syndrome, post-COVID syndrome or long COVID, and death. So the current recommendation is that all adolescents receive one dose of the updated 2024-2025 Pfizer vaccine or one dose of the updated 2024-2025 Moderna vaccines. So Pfizer and Moderna have released new updated vaccines, and so those are now authorized in the United States, and it is recommended that adolescents receive one dose of either one. So next, we'll discuss what to expect when getting a vaccine, including common side effects, vaccine ingredients, combination vaccines, immunization records, and the Vaccines for Children program, which provides vaccines at no cost for eligible children. And I'll discuss that once we get to the Vaccines for Children program slide. So any vaccine can give side effects, and side effects will vary depending on the vaccine given. These are the most common vaccine side effects that are seen in adolescents, which include soreness, redness, and/or swelling at the injection site, irritability, muscle aches, low-grade fever, and fainting. The side effects, most side effects from vaccines are mild and will resolve within 2 to 5 days. The side effects usually occur within 12 hours of being vaccinated. Serious reactions to vaccines are rare, but you should contact a healthcare provider if your adolescent is exhibiting any symptoms that concern you. As the video mentioned, every ingredient in vaccines serves a purpose. They do one of the following: provide immunity, keep the vaccine safe and long-lasting, or they make the vaccine more effective. And as the video mentioned, vaccines have been proven to be extremely safe and extremely effective over the course of several years. Actually, a new study just came out from the CDC where it looked at routine childhood vaccination for children born between the years of 1994 and 2024. And overall, it is extremely beneficial health-wise and economic-wise for children to be routinely vaccinated against these vaccine preventable diseases. So many vaccines can be given together in what is called a combination vaccine. And I mentioned one of those when I talked about the meningococcal vaccine. Combination vaccines take 2 or more vaccines that can be given individually and put them together in one shot. So at a doctor's visit, your child may only get 2 to 3 shots to protect them from 5 diseases instead of 5 individual shots. Combination vaccines do not lower the efficacy, or they do not affect how effective the vaccines are. They're just as effective as individual vaccines. MMR, the vaccine that protects against measles, mumps, rubella, and the meningococcal vaccines that I spoke about earlier are examples of combination vaccines. There are several benefits to combination vaccines for children and for parents. For children, it means fewer shots, less pain and discomfort, and on-time protection. For parents, it means fewer visits to the doctor, less hassle and cost, and then less time off from work and family activity. Here's where you can get your adolescent vaccinated because these are vaccines. Because these vaccines are recommended vaccines by the Advisory Committee on Immunization Practices. These vaccines are covered by most insurance companies. For those who are uninsured or if your insurance doesn't cover all vaccines, you can visit your local health department, a public health clinic, or an FQHC, which is a federally qualified health center. So the Vaccines for Children program is a federally funded program that provides vaccines at no cost. Vaccines are free, but clinic sites may charge an administrative fee. No one can be refused vaccines if admin fees cannot be paid. So that's important to keep in mind. To be eligible to receive a vaccine under the VFC program, your child must be under the age of 19, Medicaid eligible, uninsured or underinsured, or a Native American or Alaskan Native. And to get your child vaccinated under the VFC program, you can go to a federally qualified health center, a local public health clinic, or a local health department. You can also ask your child's pediatrician or healthcare provider if they also participate in the VFC program, but just be sure to inquire about any additional costs. It is extremely important to keep track of your child's immunization record and to keep it up to date. Immunization records are needed for schools, colleges, and childcare, extracurricular activities, traveling, adoption and fostering, and even when your child becomes an adult. So you can keep track by maintaining and keeping safe your own copies of your child's records. You can ask your child's doctor how they keep vaccination records. You can also ask them for a copy. You can also ask your child's doctor to enter all of your child's records into New Jersey's official immunization information system, which is called NJIIS. Doing so makes your child's records even more accessible across all the providers in New Jersey. So if you change providers, your new provider will be able to access your child's immunization records. And then luckily for New Jerseyans, we do have an app called Docket where we can access our immunization records from our phones. You can download Docket from your app store. It is available for Apple and Android users. The CDC also has tips that can be used to make shots less stressful for your adolescent. Number one, you want to do your research. Read up on the recommended vaccinations for your adolescent so that you know what to expect. You can also talk with your child's doctor. You also want to be honest and calm. Take time to explain to your adolescent what to expect. And then you can use distractions. You can have your adolescent look away. You can give them fidget toys, or you can use any other distraction that would just keep them calm. And then these are some frequently asked questions that parents usually ask about vaccines. First, are vaccines safe? As I mentioned, yes, they are extremely safe. Numerous studies have shown them to be safe and effective. Do vaccines cause autism? No, this is actually a common misconception. Scientific studies and reviews continue to show that there is no relationship between vaccines and autism. This misconception actually came out of a 1998, I believe, study that was found to be unethical. And the doctor that conducted the study actually lost his medical license and is no longer able to practice medicine. Because in that study, he tried to assert that there was a link between the MMR vaccine, the measles, mumps, rubella vaccine, and autism. But as I mentioned, studies continue to show that there is no link between autism and vaccines. Will a vaccine make my child sick with a disease? This was addressed in the video. No, it's not possible to get infected with the virus or bacteria from a vaccine. Should my child get shots if they are sick? Children can usually get vaccinated if they have mild illnesses, but you should, of course, talk with your child's doctor and follow their recommendation. Can shots be delayed? Anytime you delay a vaccine, you leave your child vulnerable to vaccine preventable diseases. So it's important to follow that recommended immunization schedule. Why are multiple doses needed for each vaccine? Depending on the vaccine, more than one dose will be needed to build high enough immunity to help prevent disease or to boost immunity that fades over time. Is natural immunity better than vaccination? No. It is better to prevent illness by getting vaccinated rather than getting an infection. I listed all of those risks that comes with those infections, with HPV, with meningococcal disease, etc. And it's just not worth risk putting a child at risk for those complications. And it's just better to get them vaccinated. Vaccines also lower the chances of spreading a disease. And then lastly, if a disease is not present in my community, do I still need to vaccinate my child? Absolutely. Even if it's not present in your immediate community, it can be present in other parts of the world, and your child can encounter the disease from someone who traveled. As I mentioned, we are seeing cases of measles pop up in the United States. Currently, there's a polio outbreak overseas in Gaza. And so that is an instance where if someone that has polio can travel, or if someone travels to that area, they are at risk of attracting polio if they are not vaccinated. So routine vaccination is just extremely, extremely important, and following that recommended schedule. So there is a lot of misinformation and disinformation out there. So be sure that you are getting your information from trusted sources. And this is a list of trusted sources whose websites you can visit to get more in-depth information. Vaccineinformation.org actually provides all of this information in very simple terms. And I believe that it is also available in multiple languages. So I definitely would recommend checking out that website. And then I will take any questions if you have any. And in the meantime, I'll share my contact information. This is where you can contact me either via phone or email. If you have any further questions, don't hesitate to reach out. Or if you need assistance locating a vaccine location or a vaccine for children site, you can contact me as well.
I'd like to thank Jasmine for sharing this important information and your time today, Jasmine. Also, a thank you to those who joined us for today's Lunch and Learn. If anybody would like access to this presentation, it will be up on our Family Partners YouTube channel by next week. Again, thank you, Jasmine. At this point, I'll stop the recording and open it up to questions.